Hi, I'm a child psychiatrist from London. I don't have any competing financial interests to declare, but very often it's not the financial interests which are the most important. And I should declare that I was chairing a nice process of making guidelines for the treatment of ADHD, and that I have books published outlining a particular approach to ADHD, and I've run a trial on fish oil funded by the food company that manufactures it. I stress the competing interests because this has been a highly controversial area, and the differences between America and England are tenfold in the drug treatment for ADHD. In England, we treat 10 times fewer than in America, and in this country, they treat 100 times less than in America with drugs for ADHD. So it's plain, I think, that nobody knows the right answers. Persisting and impairing inattention, impulsiveness, and overactivity has a fairly constant frequency across different countries, but in most European countries, most children go untreated for ADHD. The trial evidence is about drugs, especially stimulants and atomoxetine, to a certain degree other medicines, and various psychological therapies, of which I'll be emphasizing behavior therapy as those treatments with the best evaluated outcomes. I want to go through the scientific basis for trying to decide whether one is using psychological or pharmacological therapies in keeping with the theme of the meeting. And the scientific evidence falls into different groups. The first is the randomized controlled trials of efficacy. The second are the economic costings of the different therapies to put into a balance of what's used. The third is whether there are subgroup differentials. There are some children who should be treated preferentially with one rather than with another. The fourth is the issue of long-term hazards. And I hope that when we've put those together, we'll be in a position to answer the question of drugs or no drugs at the end. It's a complex disorder. It's multiply caused with a number of known small DNA changes that influence the development of it. Psychological causes come into it as well. And the result is a kind of temperamental difference in the children, present from quite an early age. A consequence of that is that shapes up a harsh environment around them. Peers reject them. Parents tend to be lacking in warmth and high in criticism, and sometimes they come in for physical abuse of one kind or another. And indeed, many children who've been abused in one school or bullied in one school move to another and encounter the same problem in another school. That harshness of environment, in turn, engenders distress and aggressive behavior in the children, which persists over time, and that is influenced by a different set of genes as to how far they will react to the harsh, controlling environment from other people. Now, I think we can be confident that the psychological environment is important as well. It could be, in theory, that there is a genetic link between parental aggression and child ADHD, but Temya Moffat and Avsham Kaspi and colleagues have reported from the E-RISK longitudinal twin study, interviewing monozygotic twin pairs and showing that within those genetically identical children, the twin receiving more maternal negativity and less warmth is also the one who develops more antisocial behavior problems. I think we can say that area is important. It's not just the influence of the parents on the child, because in one trial that we did some years ago, the difference between placebo medication and active medication of the child made a very large difference to the hostile expressed emotion coming from the family and from others. But it's not the whole story, because as well as that indirect transactional causality,